Yesterday's big announcement from the CDC that vaccinated Americans can shed their masks in most situations is helping everyone get just that much closer to normal. But people still have lots of questions. As millions of vaccinated Americans begin a mostly maskless life, an air of excitement from coast to coast.
I'm ready to rip it off.
Thank God we're free.
The CDC releasing new guidance saying fully vaccinated people can ditch the face coverings and stop social distancing in most cases, with COVID-19 numbers going down across much of the country.
I see this as a brand new day. I'm excited to put away my mask, to go out and engage with friends and others like I used to.
But still a lot of questions and some hesitancy.
The question in my mind is when? What's the right time? And this feels premature.
There are exceptions. The CDC saying everyone should still wear masks in hospitals, on buses, trains, and planes, and if required by a state, county, tribe, employer, or business. Michigan, just a month ago, facing a surge in COVID cases, now lifting its mask mandate. But a number of states, like Massachusetts, keeping their policies in place.
There are some areas in this country that still have quite low vaccination rates, and so we can't treat it necessarily as uniform, and a lot of those decisions are going to happen at the jurisdictional level.
Target and Kroger still requiring face coverings. CVS says it's now reevaluating. More than 118 million Americans are now fully vaccinated, about a third of the U.S. population. A new CDC study says the mRNA COVID vaccines were shown to be 94% effective at preventing symptomatic COVID-19. But experts recommend unvaccinated people, including children, still wear masks indoors and in certain outdoor situations. And for even more answers, we turn to our next guest, Dr. Amesh Adalja. He is a senior scholar at the Johns Hopkins University Center for Health Security. He's also an emergency medical physician. Dr. Adalja, let's start with the obvious questions. On Wednesday, fully vaccinated people had to mask up anytime they were indoors and around other people. As of Thursday, they don't. What changed?
What changed is the CDC issued new guidance that really reflected the state-of-the-art data that we're seeing with the real-world impact of these vaccines as well as clinical trial data. Many of us had pushed the CDC to be bold and to be aggressive and to take that action earlier, but it's better late than never, and I think it really is a concretization of how these vaccines have the ability to change your life.
For the better part of a year, we've been hearing about herd immunity as the goal, but even with the vaccines, we're really nowhere near that point, and more experts are saying that we may never get there. That's got some people worrying that we might be moving too fast on this. How would you respond?
I'm not worried. And remember, herd immunity, although it is an important milestone, it's not necessary to cross that threshold in order to get control of the pandemic. Remember, the vaccines were designed to do three things: stop serious illness, hospitalizations, and death. And they've succeeded at that tremendously in the United States. Walk around in a hospital now in May of 2021. It's very different than what it was just in January of 2021. And that's because the vaccine went to those high-risk populations and basically tamed or defanged this virus. And if you look at countries that are highly vaccinated, like Israel, when they crossed around 40% of their population fully vaccinated, they sort of hit a tipping point where cases fell precipitously. And I think we're on that trajectory now in the United States with about 35% plus of our total population fully vaccinated. So while it's great to aim for herd immunity, we will get the benefits of the vaccine well below the herd immunity threshold.
As you mentioned, the percentage of people fully vaccinated in the U.S. is around 36%. That means about 64% of the country isn't vaccinated yet. And of course, there'll be no way to know if you're standing next to someone who's unmasked and unvaccinated. Now, I get that's going to be a bigger danger to the unvaccinated person than the vaccinated one. But is there still danger for the vaccinated person in that example?
No, if you are a fully vaccinated person, you really don't need to fear COVID-19. The virus is going to treat you very differently because you've been fully vaccinated, and that's why people can treat you differently. So you should not have any fear of other people that might not be unvaccinated if you're fully vaccinated.
So what should the mitigating factors be in the decision-making process for vaccinated Americans as they decide what to do in public and whether to wear masks or not?
I would tell them to go back to as much of their pre-pandemic habits as they can. There's going to be certain places where they still require masks because it's going to be hard to imagine, for example, a convenience store clerk to know who's vaccinated or who's not vaccinated. So they'll probably just say all customers need to wear their masks. And the same might be true on public transportation. But in all other settings, if the local regulations, if the private property owner allows you to remove your mask if you're fully vaccinated, I say go for it.
We have, of course, heard about some vaccinated people who then test positive. There are 8 players on the Yankees, the comic Bill Maher now among them. Of course, that's going to get people concerned. How do you respond to people who hear about those cases and start to either question the vaccines or the mask policy or both?
Well, first of all, you have to remember that when you hear about these reports of breakthrough infections, they get headlines because they are so extremely rare. So the CDC reports about 9,000 breakthrough infections, and that sounds like a large number until you know the denominator is around 100 million people fully vaccinated. So if you do the math on that, it's a decimal point with 4 zeros before you get a number. That is extremely low. So while breakthrough infections might occur, they are unlikely to be clinically significant. Most of them are not even people who have any symptoms. Most of them are not even associated with any level of virus that's contagious to others. So I don't think that following breakthrough infections in this situation, especially ones that have no symptoms at all, makes much sense. And it doesn't really change the value of the vaccines because they are so exceedingly rare that it's something that gets reported because it is so exceedingly rare.
The CDC has offered some specific examples of activities that are safe for vaccinated people. Obviously, it's not an exhaustive list. I keep wondering about big indoor events where people are going to be vocal. Arenas during basketball and hockey playoff games, concerts, Broadway shows, big churches, things like that. There's obviously a greater risk with the crowd cheering or singing. If you're vaccinated and masked in those environments or not masked, are there concerns in that kind of environment where you would think there would be an inclination for airborne transmission?
Not if you're a fully vaccinated person. I think in those situations, you are going to be safe. Remember, no vaccine is 100%, and the risk can never be zero. We can't put this virus back into bats. But I do think a fully vaccinated person in those types of situations really has little to fear. It's important to remember that we're not going to get to COVID zero. We've got to come up with a way to understand that there is this non-zero risk that's going to be with us now every time we step out the door. And being fully vaccinated gets that risk as low as it possibly can be without being zero. But I think people have to learn that this is now something that's out there, that we aren't going to get to a COVID zero world. And I think it's time for many people to get vaccinated and to get back to their lives.
Since we aren't going to know about people's vaccine status, do the new CDC mask rules push you one way or another on the value of vaccine passports or on companies, schools, and other entities requiring vaccinations?
I have always been in favor of having an easy way to verify vaccination status for businesses, because I think a business, if they're catering to vaccinated only people, or maybe they have a section that's only vaccinated only, they want to know that really quickly and easily. And I think there should be some innovation around apps and secure ways to verify someone's vaccination status, because a company or a business can go up to a higher capacity if they're dealing with vaccinated people. They can be more lax on social distancing rules if they're dealing with vaccinated people. So I do think that letting private industry be able to come up with innovative solutions to verify someone's vaccination status is going to be something that gets us quicker on the path to normalcy, and also rewards vaccinated people for being vaccinated and no longer being a threat to others.
Finally, Dr. Adalja, I want to ask about the single largest block of unvaccinated Americans, children under 12 who still aren't allowed to be vaccinated yet, though we heard from Dr. Fauci. He says that'll probably happen by the end of the year, if not earlier. Having them vaccinated would certainly make decisions easier for parents of younger kids about where they can safely go and what they can do without fear of putting their kids at risk. Of course, other parents are terrified of any sort of vaccine in their kids. How important do you think vaccinating kids is to our overall return to normalcy? And what would you say to frightened parents?
So what I would say is that vaccinating children is something that's a good thing to do, because although children are spared from the severe consequences of disease and they're not the major spreaders of infection the way they are with influenza, we've had children's lives disrupted because many parents, even though the risk is very low, have been very risk averse with their children. And children have been out of school for a long time. They've been unable to psychosocially develop as well as they would without this pandemic. So I do think getting them vaccinated makes it easier. And it's not necessarily because the child gets a lot of benefit from the vaccine itself, but it might give parents a peace of mind to kind of loosen the reins on children children. It also will push teachers' unions and school boards to stop putting obstacles in the way of in-person schooling. So in that sense, I think that getting children vaccinated makes sense. Although strategically looking, those vaccines would probably be better used if they were going overseas to high-risk individuals in countries that are experiencing major surges. But that's not going to happen. So I do think that these are safe and effective vaccines in children. The side effect profile looks extremely good in those 12 to 15. The efficacy looks really good. We're going to get data on that 6-month to 11-year age group eventually. It's going to take some time, but I suspect that these vaccines will look good in that age group as well, and that age group will be eligible for vaccination. But I think, again, it's not necessary that those children be vaccinated in order for them to get back to their lives, because children are generally spared from severe consequences. But it's been the psychosocial impact on children, I think, that the vaccine really will help counter.
Dr. Adalja, really appreciate it. Thanks very much.
Thank you.
Up next, the job market recovering from the pandemic, but it's slow going. Republicans say that's because federal unemployment aid is too generous, leading would-be workers to stay home. After the break, we'll speak to an expert on the subject who says that's simply not true.